Thank you, Madam Speaker. This week marks the home stretch of the health care debate. Reform will pass if people focus on the facts and the opportunities. No more outsourcing our analysis to the talking heads. Now facts matter, and the American people should find them. Healthcare is in crisis, not just because we pay more for mediocre results in our healthcare system. The number of uninsured Americans is increasing, soon to reach 50 million Americans. And health insurance is getting worse for those who already have it. It's more expensive, they have higher co-pays, higher premiums, then people have to fight to get their health bills paid. The United States is the only industrialized country where people go bankrupt from health care. This year, 1,000 people that I represent back in Oregon will go bankrupt from health care costs, and most of them will have health insurance. Medicare is a great success story. Most of us recognize that. It was enacted over many of the same objections that I'm now hearing from my Republican colleagues 45 years ago. Medicare has been responsible for our senior citizens getting the health care outcomes that people in most other developed countries enjoy. Opponents attack government-paid insurance in France, Germany, Switzerland, and Canada. But most American families would welcome the health care results in those countries, where people get sick less often, they get well faster, and they live longer, and they pay far less than Americans. We have a huge problem because Medicare is at risk. It's on an unsustainable financial path while it penalizes low-cost, high-value states like mine in Oregon or Wisconsin or Iowa. The House bill shows how to make those important reforms. Finally, part of the problem today is that there continue to be brutal political attacks that are unfettered by the truth and history. I take some of this a little personally because my bipartisan legislation to help families make sure that their end-of-life decisions are respected morphed into the Sarah Palin, quote, death panel, which I'm pleased to report was judged the lie of the year. The mandate to buy insurance, which has been an object of attack, was in fact a Republican idea that was introduced as an opposition to the approach that was offered by the Clinton administration. And now we're having people fight to prevent any change in Medicare, despite the fact that they admit it's on an unsustainable path, and they themselves have proposed some of the most draconian efforts to cut, some would say gut it, in the past. Is the legislation that we will be considering this week perfect? No, it's not. Of course, I've only been here 14 years and I've not yet seen a, quote, perfect bill. And the sad decision that was made to follow Republican leader Boehner's admonition to not legislate, but to communicate, to talk and argue, actually made it harder to make good legislation. Is this the final word in health care reform? Not by a long shot. We'll be working to refine and improve this legislation for months and indeed years to come. But is it worth doing? Absolutely. This is a critically important step, the most important since Medicare was created 45 years ago. The gist of this legislation passed the Senate 10 weeks ago. A month before that, the House passed its legislation. The facts are clear. The legislation is available. If the public and Congress focus on the facts, this bill will pass, and a sick American health care system will start to get better. Thank you, and I yield back.